if you have any questions or want to make a comment, you can either chat it into the box, or you can also unmute yourself and say something if there's a comment you want to make or a question you'd like to pose to the group. We do ask that everyone mute their phone. If you're able to, that would be great. And as I mentioned before, we're very happy to have you all with us today, and Bev is going to be recording the webinar. So Bev, is the recording started?
Yes, it has.
Okay, thank you. All right, welcome everyone to Advocacy for Oral Health Policy 101. My name is Melissa Kleffner-Wansing, and I am the Grants and Performance Management Director with the Coalition. I joined the Coalition in November of 2015. Just a little bit about myself, since not everyone knows much about me. I am a social worker, and prior to coming to the Coalition, I was the Assistant Bureau Chief with the Bureau of Genetics and Healthy Childhood at the Missouri Department of Health and Senior Services. I was the project director for federal maternal, infant, and early childhood home visiting programs. And I also worked for a bit in the oral health program within the Office of Primary Care and Rural Health. And prior to joining the department, I was a social work clinician for about 8 years with both St. Mary's Health Center and their hospice program. So I've kind of done a little bit of this and that, and I'm very glad to be with the Coalition. And as you all know, Gary Harbison is our Executive Director. And I also want to give a shout out to Nancy Kettenbrink. She is our Office Manager. And as I mentioned earlier,
I'll just say good morning to everyone. This is Gary. It's good to have you on here. I'm not going to go through my biography. I think everyone on here knows me pretty well at this point. Just to be clear, Nancy is not actually joining us this morning, but we did want to mention her since she's such an important part of operations for the Coalition.
Absolutely. And again, we want to hear from you. Please feel free to speak at any time during the presentation. This is an informational presentation, and we want to hear about your expertise and your input. Again, you can chat in the chat box on the right-hand column of your screen. You can also type in questions or comments to the group, or also just to us as well. And then if you have your phone muted, just unmute at any time and let us know what you're thinking about. And right now, I'm going to hand it over to Gary.
All right. Well, just a brief overview quickly. The Coalition for Oral Health is a nonprofit advocacy agency. So we're a 501c3 public charity focused on policy advocacy. And the mission is to improve the oral health of all Missourians through sound public policy and public awareness. So this serves as an anchor for just about everything that we do, and it serves as an anchor for things that we don't do. We sometimes say no to suggestions because they don't. All things do not fit under that mission. And our vision is, I think, an interesting vision. It is that oral health is a high priority for all Missourians. You have to think about that a little bit. So that would mean the public does what they typically don't do, and that is think that oral health is an integral part of overall health. At the same time, we have worked to make this a high priority in the policy arena. So we want to not have what's happened in the past, where oral health is considered an extra add-on policy or service area, and then is disregarded, or as happened in 2005 and happened in Missouri and happened in many other states, benefits are cut from the Medicaid program. So the vision is an important one, as the mission is important as well. So I'll talk a little bit about our policy goals. I'm probably not going to go into all of these. Next slide, please, whoever's advancing the slides. but I'll walk through it real quickly. So one of the things we have been working on in the past several years is Mo Health Net dental benefits for adults. That's been missing, as I mentioned, since 2005. We have obviously made some progress on that. Expansion and protection of public water system fluoridation. We spend quite a bit of time on that. Of course, is a great public health intervention. And then we want to see improvement in Mo Health Net, in particular by implementing best practices and system improvements. And we specifically mentioned to increase provider participation in Mo Health Net participant usage. We have worked on expansion of access to dental sealants for children without routine dental care. Missouri has been noted in the past as being pretty weak on use of dental sealants. And we do have the other goals are kind of, they're there. We're not actively working on them for the most part right now, but there are important goals, inclusion of a comprehensive dental benefit in Medicare. Obviously, that's a federal policy, so it's difficult, but we work with other partners around the country. Implementation of statewide public awareness campaign about the importance of oral health. In some ways, we work on that all the time. We have a fair number of media contacts. And then strengthening provider networks and expansion of service delivery for dental care of high-risk, vulnerable, Mo Health Net, uninsured populations, including people with disabilities and special health care needs. I think this goal is important, particularly because of that last phrase. People with disabilities and special health care needs often have difficulty finding a provider that has the knowledge and skills to work with them. And we've worked with that a little bit. But it shows a commitment to that area. I think it's important. And of course, reinstating adult dental benefits in Medicaid is the thing that we've done that's most directly related to, strengthening service delivery of oral health care in Missouri to date. And then we've had a goal out there for a while, inclusion of robust oral health benefits as implementation of the Affordable Health Care Act moves forward. Obviously, that hasn't happened in Missouri. We haven't had a good venue for talking about that. We have worked a bit on integration and coordination of oral health with primary medical care, primarily through work of our partners. So that's a quick introduction of the overall policy goals of the coalition. The other thing I'd say about that is those are created by a consensus of the board, and so controversial issues quickly get bumped off of our policy agenda, which is important because it is our collaborative work together that has created momentum and created movement. And so we hang together pretty tightly on this rather extensive list of policy goals, and I think we're doing great work together. So those are my comments about policy goals.
All right. At this time, I would like to introduce Dr. Beverly Triana-Tremain to the webinar. She has over 30 years of public health teaching, research, and consulting experience. Her background and skill set blends theoretical and practical approaches in evaluation, research, and quality improvement processes. She is a fellow in the National Public Health Leadership Institute, and in 2006 established Public Health Consulting, LLC, to assist agencies in improving the public health system. She serves as a technical consultant to various local, state, and national private and public organizations in evaluation, research, and quality improvement. She is the evaluator or quality improvement consultant on grants received from the Robert Wood Johnson Foundation, CDC, SAMHSA, RAND, HRSA, and various state and local health departments. As a former research associate with RAND, she developed instruments for data collection, conducted key informant interviews on community change, and analyzed data. Currently, she serves as epidemiologist for the Substance Abuse and Mental Health Administration's Center for Applied Prevention Technologies for the 9 states and 5 tribal entities in the Southwest region. There, she assists states with evidence-based decision-making for increasing shared protective factors that decrease the likelihood of substance abuse. Welcome, Bev.
Thank you, Melissa, and thanks, Gary, for the introduction there to your goals and your mission. And I welcome everyone to the call, and please call me Bev, and it's great to be here today. And first, I want to learn about more who's on the call. And so can we introduce ourselves if we want to go around, and maybe we could just call on as you came in. Let's see, Dr. Dane, I believe, John Dane.
Yes, I'm the new state dental director for Missouri. I started in January. I retired from 38 years at Truman Medical Center there in Kansas City and running a safety net dental clinic there.
Okay, well, good to have you on the call. How about Dawn?
Good morning, everyone. I think I know everyone on the phone, and you know me except for Beverly. I'm a senior program officer for the Reach Healthcare Foundation, which is a healthcare foundation that supports 6 counties on 2 state lines, Missouri and Kansas. And oral health has been one of our top priority funding issues since our inception 12 years ago.
Mm-hmm. Well, good. Yes, I'm familiar with the Reach Foundation. I met one of your officers not long ago and very impressed with what they do. I worked for about a year in some public health work, and they were funded by the Reach Foundation. So very nice to have you.
Thank you.
How about Karen?
Good morning. This is Karen Dent. I think everybody knows me. I am the director of the Missouri Primary Care Association's Oral Health Network of Missouri. So we work with safety net clinics throughout the state in helping them fulfill their mission of quality dental care for the underserved.
Okay. All right. Well, thanks, Karen, for joining today. How about Vicki?
Hi, I'm Vicki Wilbers. I'm the executive director of the Missouri Dental Association.
Okay, great. All right, thanks for joining, Vicki. Well, let's go ahead and get started here. And I just wanted to let you know what we're going to do today and kind of give you a roadmap. If you like my little road here, my little car. We've got several things to go over, several sections, but please at any time feel free to interrupt me and let me know that you have a question or comment or just something that you want to say. I'm here to learn from you, and everyone wants to learn from everybody else. So first we're going to talk about some vocabulary related to the topic we're talking about today. Then we're going to move on into the phases of the legislative event, and Gary and I will be covering that and talk about the beginning and the middle and the ending and kind of the closing of what will be done on Lobby Day, because the purpose of this is to prepare individuals for that Lobby Day. Section 3, we certainly want you throughout the time we're on the call to tell us about your experiences advocating for oral health, and that is with a legislator, with a legislative attendant. You know, wherever you have experience, we want to know about that, and not just during the Section 3. Anytime you think of something you want to share in the chat, remember Melissa mentioned the chat box over there, feel free to put something in, and we will address it. We are monitoring that and want to hear from you. The next thing is we want to know what you're going to take away from this today, even if it's just a renewed dedication to oral health, which obviously I know you all have to begin with. And then, of course, we're going to have the closing and evaluation. This webinar will be evaluated. We want to know what you're thinking about it. So, okay, and there is my car. Let's go. All right. So the next slide, I do a lot of, actually I'm right in the middle of doing my genealogy. My husband got me a DNA kit for Valentine's Day. I thought that was a very unique gift. And so I've gotten on Ancestry.com, and I've traced my ancestry all the way back to the 1500s, and it's just unbelievable, 1600s, all the way back over into England. And so I'm extremely interested in history, and I always try to weave history into my presentations. And so when I saw this quote by Thomas Jefferson, and you may be familiar with it, we in America do not have government by the majority. We have government by the majority who participate. And that is ever more apparent today. If you look at the news and you stay up with these trends that are occurring, then you certainly understand that. So advocacy, public support for or recommendation of a particular cause or policy. We just want to go over these two different vocabulary words right here just to make sure we're all on the same page. So when you advocate something, you know, it's a professional work of a legal advocate, for example. And that's what we're trying to do, is advocate for oral health policy here, all the way up the ecological chain, if you will. Advocate for education around oral health, and then advocate all the way up to public policy. And then you get into health advocacy. Let my slide advance there a little bit. And this is, you know, I'm not sure when this term was coined. Maybe you guys have better knowledge of that, but health advocacy, which is integral to achieving better health outcomes for individuals and communities, and to improving health services and systems. And that's so important because what it does, and I like this last phrase here, is it challenges services, systems, and the broader community to respond genuinely in meeting the express requirements of consumers. And the words I like in that phrase are it challenges. I like to say respectfully challenges, or, you know, however it needs to be, but we have to stay and keep on watch with how consumers are receiving services and anything that has to do with their health. And so this is what advocacy can do, this health advocacy. It can challenge services and systems, and to me, to be better, and to use data to make decisions about the health of our citizens. So let's move on. Now we have the phases of the legislative event. Let me give it a second to forward there. Okay, so we're looking at the phases of the legislative event, and when we designed this webinar, we wanted to make sure that we had a frame for it. And so we thought of, you know, you're preparing for the legislative event, we have a first meeting with the legislator and or legislative attendee, you have the conversation, and you try to close that out, and then there's after the meeting. Now, based on, it sounds like the experience of those on the call, you've done this before, and so, so I want you to share any of your experiences in any of these phases. You know, they've written manuals on best practices of speaking to legislators and getting the attention of legislators on important policy issues. So we want to know how you do that, what best practices there are. All right, and so we have preparation, first meeting, conversation, closing, and after the meeting. Okay? So let's talk about the preparation. So what's important to do is reviewing the type of legislative interests of your legislator. That would be a great thing to do, to go on their website, and you will be provided your legislative contact, or already have. And it's important to find out what they're interested in. And I think specifically, if I were, you know, talking to someone who was new at this, is find out how their interest connects to oral health. And I in public health, I can always find a connection, you know, there. That's a very important connection, and one that should be seen more. We are not engaged in partisan politics. You know, health advocacy can stand on its own and be an important part of the process here. But we're interested in the health of all people, that common good message. In one word of recommendation, it's not recommended that you pull people off the floor unless you've done that before, or the legislative attendee wants you to do that. So, all right. And just to shout out to you, these pictures on the right, these are former Missouri legislators. So just to give you some historical context there. So that's preparation, and we're going to go on. So don't expect to be a content expert, which, as I can tell, many of you, or all of you, have some expertise in this area, or much expertise in this area in oral health. So certainly we want you to use that. I think the main thing is keeping it real. Legislators do welcome real conversations. And it's not a debate, but a conversation, and just keep that in mind. Any questions so far or comments? Melissa or Gary, do you have any comments or anything to add?
Yeah, this is Gary. I'll just make a couple of comments.
Sure.
I think the emphasis on kind of developing a relationship with legislators, and many people on the call have done this before, but this is being recorded, so there'll be others that will listen to this as well, and including folks that we have at our Oral Health Legislative Awareness event that have never done this before. So there's basics that I want to just mention real quickly. It's important that you go in there and you get across to the legislator you're speaking to that you're concerned about oral health, about the oral health of the community, really the oral health of everyone, or you can even say the oral health of my community, especially if you're the actual constituent of the rep or senator that you're talking to. So you want to get that across. I'm a constituent. I'm concerned about the oral health policy and about the health of the community, and I'm here to have an interaction with you. There is an ask. We'll get to that, but I think beyond that, it's just important to have that contact and have somebody talk to a legislator saying that they're interested in oral health. I think people often do not understand what a tremendous impact they can have in just being a regular person that goes and speaks with an elected official about a particular policy arena. People do listen. They will listen to you, and they'll take you seriously. So I just emphasize that you don't have to go in there with fireworks and all the answers and all that.
Yeah, that's great, Gary. And that reminds me of the work I do in substance abuse and mental health. And I know that the policy makers, they can get data. It's important to get them the data to make those evidence-based decisions. But it's also important that they hear stories behind that data. So it's the heart and the brain, as I say. It's that story of the data. So that's why you're so important in this process. So let's just go forward, and what we're going to do now is give you a chance to tell what you know. I know you have a wealth of experience, it sounds like, and this call, as it is being recorded, and we want to make sure that we capture as much talent and expertise as we have on the call for those who may be just starting out in health advocacy. So we would like you to just consider these questions. Have you ever participated in a previous oral health legislative awareness event? Tell us about the experiences. How many legislators or staff have you talked to? Can you tell us the most memorable experience that you've had? And it doesn't have to be anything, that spectacular, but it could be something very small that you think really made an impression and that moved your message along. And lastly, what are some of the toughest questions that you've been asked before or have had to fill and maybe didn't know the answer or did, and you felt like you handled it well? And you can take any of these questions that we pose for you. And so just feel free at any moment if you want to just unmute yourself and tell us your thoughts on these questions. We want to hear from you.
Yeah, this is Dr. Dean. I had the opportunity to work several times with the lobbyist for the Missouri Dental Association and the lobbyist for Truman Medical Center at the time in visiting Capitol Hill to lobby for funding and programs for the developmentally disabled adults in the state of Missouri. The advantage of that is, of course, that the lobbyists did a lot of the preparation because they knew the individuals they wanted us to go see. They knew the backgrounds of those individuals, what were the areas of interest, and so we were able to kind of couch our presentation towards those kinds of areas that we might have the greatest results. And each time that we came through, four in total over the years here, we would see anywhere from 8 to 10 legislators, people on the House side and on the Senate side. There were certain individuals that the lobbyists wanted to get us in to see that we couldn't get in to see, and they had, you know, individuals that were targeted. Like, since we were asking for funds, they tried to target anybody on the Appropriations Committee that we could get a chance to see. And usually it was only a 5 or a 10-minute opportunity to talk to the legislator and get our point across as quickly as possible. I don't think I ever had any particularly tough questions asked of me while I was there. But one of the legislators that we did visit one time also happened to be at that time somebody who was a gun advocate, and after I'd given my 5-minute little spiel, I had 15 minutes on why the Second Amendment of the Constitution wasn't being observed well in the state of Missouri. So sometimes you get not necessarily blowback, but an opportunity for that legislator to give you his point of view. So.
Right. Right. Thank you, Dr. Dane, for that expertise. So that's good information for, especially for someone just starting out in this. Others?
This is Dawn. I'll add on one, I guess, important takeaway that I've gained over the years. On the Kansas side, we have been supporting legislation around dental therapy, creating that mid-level position in the state of Kansas. So when we go each year and speak with legislators, we also speak to anywhere between 4 and 8 typically during the day. Many times they're on the floor and we do not pull them out. But I think the important thing is if they're not there, that you leave materials behind with a handwritten note. That way they know that you did stop by, it's still important, you put it on their radar, and then hopefully there's a follow-up after that. You can convey your messages. One thing that I've always found helpful too is in the preparation, try to anticipate the questions they're going to have for you. And one specific that we usually get is, what are the opponents going to say? When they come in tomorrow, what are they going to ask me, or what are they going to tell me? So what do you want me to know? So again, just being able to give your point clearly and concisely, and then try to refute what maybe the opponents are going to say with factual information. And then specifically, not only their area of interest, but what is it that specific interest at the time? So is it that your bill will help create jobs? Will it that'll save clinics money? Will it help with productivity? What is it that's really going to, you know, get the attention of that legislator? We found has been helpful as well.
That's excellent advice, Dawn. I like that last one, is connecting it to something else that I know in substance abuse we always try to connect it to, because people kind of get tired of hearing the, you know, drugs. It's going to, you know, they could die or, you know, become very ill, and so we try to connect it to workforce development. And, you know, this is a workforce issue if everyone's on drugs, and so I like that. That's an excellent piece of advice. Thank you, Dawn. Others?
Well, this is Gary. I'll throw in a couple of things.
Sure.
I think what Dr. Dane brought up, that you could have a legislator talk to you about things that they're working on, or even just things that they're thinking about that day. That's happened fairly frequently in legislative contact that I've had, and so it's not unusual at all. Obviously, you're there to talk about oral health and about the particular policy goals, priorities that the coalition has at the time. I've heard lots of things about lots of other areas. I typically politely listen and try to stay on topic. And if they need to talk about things, I think one thing important to understand is legislators are human beings too, and they're in a kind of a hard-working environment, and they're working on many issues that are important to them, and they are thinking about lots of other things when you're talking with them typically. So it's not unusual to hear about some of the things that they're working on, and it's important to be polite about that, even though you're really not there to get into a big discussion of gun rights. And it may be too that they, like Dr. Dane said, they want to advocate with you about a particular policy issue, and certainly you're asking them to hear you out, so you should do the same for them.
Yeah, that's excellent. The table can turn on you, and they become the advocate, and you're listening to them, and the important thing is to not get rattled and maintain composure. And
yeah, and I think it's important to understand you may hear about issues that you have a strong opinion about, and you may disagree with the legislator that you're speaking with. You're there for the coalition. I would recommend you not get into a debate with them about their policy position in another area. Not to tell you that you can't do that. Obviously, as a citizen, you're free to do whatever you like. But I think for purposes of getting our asks on the table and having a good relationship, I'd leave that for later. I would maybe address, if you feel compelled, address that through another venue rather than this particular meeting. It's a judgment call, obviously.
Yeah, right. Okay. All right. Well, thank you to those who've given some good information here, good background. So if you think of something throughout the rest of the call, certainly put it in the chat or unmute your phone and let us know. Okay, so let's move on to preparation. We're just going to finish out just a few tips here on referring to them as a legislative assistant, so that is their title, and make sure that you use formal titles like Senator so-and-so, and make sure that you identify yourself as a constituent if you are, or identify yourself from your particular organization and so forth. So, all right. So we're going to get into the first meeting, and then later Gary's going to be talking about the 3 asks that we mentioned earlier. So the first meeting, so we just mentioned the preparation, and this is the first meeting, may be introduced to a legislative assistant and not ever see the legislator. That is totally likely. Certainly thank them for support of oral health and using specific examples from their work, and I think we heard that in several comments of what you said earlier, is making sure that you connect this to the overall issue of health and public health and any other issues you can make that connection to. The environment in the Capitol may be very chaotic. It's probably going to be. And Gary can talk more about that, and sounds like you guys have been there before, so you understand that. So you have to be able to adjust to interferences and noise and people being interrupted, people being on their phone, and certainly welcome that interaction with the legislative assistant. They are there for a reason. They're a trusted ally with the legislators. So treat them as you would the legislator. Certainly dress casual is fine for a private citizen. I think overdressing, you know, you have to make, that's a judgment call, but I think overdressing can have its drawbacks, and dressing too casual can have its drawbacks. So it has to be something that you feel comfortable in. Okay, and then when you first meet the legislative attendee, then you obviously say, hello, I am, with your name and with your organization. Make it very relaxed. You say you're here with the Missouri Coalition for Oral Health, and be able to speak about the Missouri Coalition for Oral Health to them. And Gary, did you want to say anything about where you will be on Legislative Day?
Yeah, so obviously we're providing this webinar now to give people a good introduction, but I also will be in the Capitol in the third floor rotunda, what's called the House Alcove. It's off to the side at the top of the very large staircase there that you can see from the third floor rotunda. And materials went out to you the other day, and I believe they were included on the email for this webinar as well. And there's maps, and we have the third floor rotunda alcove, house alcove marked on there, so it's fairly easy to find. And I can provide, you know, answer questions or provide instruction there for anyone who wants it. I'll actually be up there before 8, well before 8, and you know, just a couple of other things real quickly. I will give you my cell phone number that was on the email, so you can reach me if you're out walking around the Capitol and you have a question. Or after a while, I will be going back over to the Capitol Plaza Hotel to help with the preparations for the conference, and you can reach me by cell then as well. In terms of the chaotic environment, you know, when we talk about this, you kind of have the thought that you'll meet with the senator in their office. It may not occur that way. It may be that you end up talking with them out in the hallway with a bunch of other people standing around. That's not unusual. The LA may go, Senator so-and-so is not here, but I'm going to go grab them, and why don't you come with me? So that may happen, and or you may end up in a nice quiet office too. That certainly can happen as well. And then, as Bev just mentioned, if you just end up having a conversation with the LA, that's great. They're very important people. If you get their attention on an issue, that may even be better than getting the legislators' attention on it, because the LA has influence and can keep that issue in front of their legislators. So that's a thing. And also, when you introduce yourself, feel free to just identify yourself as an advocate. You don't have to have a professional organization. And of course, you're there for the coalition. It's fine to say I'm so-and-so here with the Missouri Coalition for Oral Health. People will be glad to hear that. So those are a few other thoughts about that interaction. Okay, thank you. All right, let's move on, and you can see my historical pictures I picked out here. So the conversation, I think this is very, very important. I know Gary's made this point to me several times on previous calls, is that conversations, and you know, they help make connections even when they're totally unrelated to oral health. And you know, oral health is part of public health, and I'm like, what's not public health? So I think even if you're having a conversation about, you know, their kids or anything unrelated, seemingly unrelated, that's an important time, and you're building that connection. It could be some personal interest that you both have in common, especially if you're from the same town. I've often made the best professional connections and personal connections when I've just had a conversation with people that was not about what I thought we were supposed to be talking about. And they end up becoming very real, and people remember those, I think, better. Small talk is important. Make that personal connection, but don't force it. I mean, I think that's something you have to practice
being able to not force that. You know, you want it to be natural. And can anyone share any past experiences that you've had that maybe you've thought of since we've talked about your personal experiences? Does anyone want to add anything? Any words of wisdom? Okay. All right. Well, let's go on. And I want to turn it now over to Gary. He's going to go deeper into what we call the ask, which is part of the conversation here. And we have the 3 asks here. Gary, you want to take it over?
Sure. Yeah, it's typical to go in with 3 things on your list, and we have that. So House Bill 1717. Continued funding of Medicaid adult dental and telehealth legislation are the 3 things that we're addressing this year. And so I'll go a little bit into House Bill 1717. I know most people actually on the call right now know quite a bit about this, but some folks who listen to the recording session probably will not know so much. This is the 4th year that we have had this bill up before the legislature. So we think we will pass this year. It is moving along rather nicely. This is what we informally call the fluoridation notification bill, and it is specifically designed to alter the trend that we have had over the past probably 15, 20 years, where smaller communities decide to discontinue public water fluoridation with very little community input, even in some instances with no community input. We think that's a bad trend. But in Missouri, it is very much a local decision, so the bill does not take away local authority. It's not a mandate to fluoridate public water, but it does require municipalities to notify their customers as state that they are considering to discontinue community water fluoridation. We think with a little heads up, and this requires 90 days, that we can have a fair shot of continuing community water fluoridation and influencing the local city council. It's typically the one making the decision about this. As it happens, that's not what's going on. So this bill has been passed by the House. It's over on the Senate side. It may be advanced by further by the time that our event rolls around, and we'll certainly provide you with an update with that. But our ask is very simple: pass House Bill 1717. You may get questions related to community water fluoridation. You know, you don't need to be an expert on that. I'd simply say you support it and you support local communities making that decision. We just want people to be involved in the decision-making process. We have had tremendous support from this legislature and in the previous years for this bill. It's not unusual for there to be a call for it to be strengthened. In fact, it's been very good for the dialogue around oral health in our legislature to have this out here. And we have had a little bit of opposition. Just a handful of folks, I think 2 or 3 voted against it on the House side. The vast majority voted for it, a tremendous amount of support. We'll flag any of the opponents. If someone gets scheduled with an opponent, we'll let you know that you've got one and you might get an argument. Chances are you're not going to run into that. So you'll want to say thank you, because people have been supportive. We think we're well supported on the Senate side as well. So the thank you is very important. And I'll add, just in general, we have a great deal of support for oral health policy in the Missouri legislature. So most of the time, that thank you is very important, because we really haven't run into a lot of opposition, very, very, very little opposition. So the second ask, and by the way, 1717 was filed by Representative Lichtenegger. Donna Lichtenegger's the second ask is what we're saying, permanently fund Medicaid adult dental. So it's funded for this year. It hasn't gone to implementation yet. And it's funded through one-time money, which has been most of the reason for the slowdown in implementation. Administration is still saying beginning of April that they'll turn it on. We expect that to happen. But for the subsequent budget years, we do not want it to be funded on one-time money. And so this is an important ask. Again, we have gotten support to date. It is in the budget. It seems to be non-controversial. We haven't had anyone speaking in opposition, but it's important to both say thank you and to ask that support continue in the budget for 2017 that they're working on now comes out with money for that. So the third ask is for telehealth legislation. There's two primary vehicles for that, Senate Bill 621 and House Bill 1923. Both of those include teledentistry as a component with that, and you simply need to ask the telehealth legislation be passed this session. Again, that is an area that has gotten a great deal of support. We haven't run into a lot of opposition with that, and I would be very surprised if you ran into someone that was arguing with you about it. And it's also expected to pass this session. So we have three asks that are already strongly supported. You're unlikely to get into a debate about these. But I will open it up. There are others on the call that know more about these areas. So does anyone have any comments about these three areas they'd like to make? Or I will take questions if you have questions on these areas. You could act like you know nothing about it and ask questions. Okay, well, they're good asks. And by the way, in terms of asking, legislators expect you to ask for something. They think that's why you're there. So there's nothing unusual about it. You don't need to feel awkward about it. They are used to that. They expect you to come in and ask for something. And we'll have copies of materials for you to take with you on those visits. So even if you're well trained and familiar with what we're doing, please drop by and see me at the third floor alcove, house alcove. And I will give you those materials. You will leave our legislative priority sheet with them. You can also leave a business card if you have one. And then we have a one-page overview for the coalition that's good to leave as well.
Hey, Gary, will you have 3 to 5 bullet talking points for folks who are going to be doing those visits that day?
They really are on the legislative priority sheets. We're going to flag the fluoride thing. So if we get opponents, I have an entire page of talking points about that, and you'll have to get a little bit more well-versed with that. But we've included more material on that because we know we have a few opponents to 1717 out there. Most of it's pretty simple. I would not recommend trying to get into details of the telehealth legislation other than just saying you support it because there's teledentistry included. And I think we leave it there. The bullet points on the adult dental, because we don't have real opposition going out there. We don't need to press too hard on that. I think 1717, there's more detail in the legislative priority sheets than you probably need, but it'll give you plenty to talk off of that. And obviously, if you run into some issues that you can't answer, you'll just tell them you can't answer it, and we'll try to follow up with them as needed. And you can try to get a hold of me up there as well. I'd be glad to join you if that's helpful.
Good.
Yeah, good question.
Okay, so any other, thanks Gary, that was great overview of the 3 asks, and just important that anyone new coming into this realizes that focused information, especially to a legislator who's busy and running here, running there, and has a million things on their mind, is always, I think, a good protocol to follow. Being very streamlined and intentional, I think, with the message is good. So we encourage you to take pictures and to share those with the Coalition for Oral Health. As you can see here, this is a previous picture of Legislative Day. So any thoughts or questions as we go forward to the closing?
Legislators love photographs. They
yes.
kind of it's kind of a fun thing to do, and I encourage to do that as well.
Yes, definitely. Good. Okay, well, this is the closing of the conversation, and I think it's important to know when to close it and when, or maybe close for you, I guess. But knowing when it's important to close that conversation, and thank them for their time, thank them for any previous work they've done in areas of particular importance to oral health. And obviously, as Gary said, to leave that legislative priority sheet and the one-page overview, and certainly leave a business card. And you don't have to be told this. You have excellent credentials, and certainly your presence there will make a difference, I believe. So, okay, let's move on. And I'm going to turn it over, I think, to Gary to talk about after the meeting.
Yeah, so we will provide you with feedback forms that you can fill out. You'll fill out a form for each legislative visit you make, and then you need to get that back to the coalition. You can give it to any of us, or there'll be a box at the registration or the check-in table at the Capitol Plaza for the conference. You could just drop them in there. And those are important because we want to know who you visited, and especially if there were questions that came up that we need to follow up on, we like to do that. Probably one of the most important things you can do, though, is to include a handwritten note. You can certainly do that when you drop things off, but I think afterward, do a thank you note to the senators and reps that you visited with. And by the way, you can get lots of information on these folks by going to the Missouri House or Missouri Senate, looking them up. You can get their address and their phone number and their biography on there, and you can see what committees they're on, what legislation they've sponsored. So it's very important to take a little time ahead of time, but afterwards, get the address, write them a handwritten note. They get a lot of emails, they get a lot of form letters, and it's my belief that handwritten notes really stand out to folks. And so I encourage that. I think, again, it will make your visit more memorable, your issues more memorable, and they'll be left with this idea, oh, now I know this person from such and such area of the state, and they're interested in oral health, and they were polite, and they connected with me, and maybe I should pay attention to these issues. So I think it's a simple thing to do a handwritten note. People just don't do them anymore. I really encourage you to do that. And I think that's most of what I have to say about after the meeting. There may be things that come up that you personally want to follow up on, and you certainly can do that. I'd like you to let us know about that if that occurs. The other thing that may happen is because they're connected with you, they may call on you in the future about this. Well, and that I think that's all. I think that's good. I think it's good to make those kinds of connections, especially for dental professionals. I think if you walk in there and you're a dentist or a hygienist, they're gonna listen to you, and they may have questions about oral health care or service provision or those kinds of things, and want to connect with you. I'm sure that's happened many times.
And the next slide is on the Oral Health Caucus. Gary, were you going to say anything about that, or?
So, you know, we're working on setting schedules, except for those folks who've told us that they will take care of it themselves. And so we'll work on scheduling you with your particular senator and representative from the district that you live in. Beyond that, we will focus on House Appropriations Committee members, House Budget Committee members, and then Senate Appropriations members, and then of course the Oral Health Caucus. So again, this is an effort of Representative Litzenegger and Senator Wayne Wallingford. Caucus is simply a meeting about a particular issue, so this is an issue caucus about oral health. They will be holding their first meeting on Monday, March 7th, so the week of the conference, and you should have gotten a notice about that. And I understand their main agenda for that meeting is introducing Dr. Dane as the new dental director for Missouri. But this is great that we have this many people that are interested in oral health as a policy arena. And this is a working list, too. There's still efforts to get additional members. So if we get an updated list from Representative Litzenegger's office, we'll share that with you. But all of these people would be folks that are friendly to oral health or interested in oral health policy and in making improvements. So these would be people in particular that should go in and say thank you. And if you are visiting a caucus member, you want to say in particular thank you for being a member of the Oral Health Caucus.
Yeah, this is an impressive list. That this many are interested in oral health. I think that's amazing.
And if I could add, this is Melissa. I've
Sure.
sent an email to everyone who is registered to attend the Legislative Awareness event, and I'm happy to set up appointments for you to meet with the senators and representatives within your district. So if you have not sent me either your home address or your 9-digit zip code where you reside, please shoot that to me in an email, and I will make sure and get those appointments set up for you if you haven't done so already.
Okay, thank you, Melissa. All right, well, let's move on to the takeaways. And we are certainly aware that we have some very credible, or all of you are very credible on the phone and come with immediate credibility to this issue. But we do want to know what your takeaways are from this webinar, and even if it's just what someone new to the health advocacy field and oral health should be aware of in their first 1 or 2 years. What do you think? What you are going to take away from this, or how are you going to use this for your work? And you can put it in the chat or let us know through the phone.
I think we have too many people who have done this a lot on the.
I think so. That's okay, though. That's all right.
Yeah, well, this is John Dane. It's interesting because, like as I said before, I wasn't necessarily on the part of the role of being part of an advocacy group and the preparation that goes into managing a group of individuals that goes into the legislature. It's nice to see what's going on behind the scenes, because there's a lot more than just having people show up and hand them a sheet of paper and point them down a hall.
Yeah, I appreciate that comment. It's a lot of prep. We try to get it to come off as well as possible, and I think we're going to have a great visit. I know that the previous 2 conferences, the folks that participated in this felt very good about their participation, and hopefully we've gotten people well prepared. We haven't done a webinar before for this. What we've done is a very brief meeting just before we send people out, and in some ways I'll still probably be doing that with folks as they need it. But we think we're prepared, and people feel good about their visits, and they should. And I am especially glad when we get brand new members and folks that haven't spoken with an elected official previously to get involved in this, because it really they learn that they can do things that they didn't understand that they can do, and have an influence on policy discussion in a way that they probably never dreamed of.
Yeah, and I like Dr. Dane's comment, and I'll just say a second about that is, I think in health advocacy, and particularly in the oral health, is we need to prepare health advocates, oral health advocates, for this work, and it doesn't need to come by accident that they're good at it. You know, this is a something that is important and needed by our children and our families and our state and the country. And so this is, I think, I commend Melissa and Gary for, you know, calling me to do this, because this should be a thoughtful, intentional work to prepare health advocates to go forward and get this issue on the radar, or more on the radar. So, all right, well, we will go into closing, but we appreciate your time today. I know you're very busy people. Certainly feel free to contact the coalition, and I'll just turn it over to Melissa to close it out here.
Okay, well, thanks again, everyone, for joining us. And as Bev mentioned, if you have any questions or you know, anything that you want to talk to us about before next week, please give us a call us at the coalition, or shoot us an email. And as Gary mentioned, he will be there before 8 o'clock next Thursday morning, and we'll have the materials to hand out to each of you, and we'll be sending the appointments to you so you're prepared and know where you're going. And also, there is a link that you see on this slide to complete an evaluation for today's webinar. So we ask you to please click on that and fill that out for us. We would appreciate it as we plan these events, and hope that we're doing what we can to get everyone prepared and feeling good about the work that we're doing, the important work that we're doing with the coalition, and trying to improve Missouri's oral health. So thank you all very, very much.
And I'll just add one other comment. Obviously, my thanks to everyone participating in this. But, you know, for the coalition, the type of collaborative work that we have all done together really is essential. And for individual coalition members, you may feel that you play a very small part. That's really not true. If we weren't working together on this stuff, we wouldn't have made the gains that we've had. We wouldn't be talking about reinstatement of adult dental or protecting community water fluoridation. We wouldn't have a state dental director again. We wouldn't have an oral health caucus in the Missouri legislature. So your individual actions very, very important as we work in a collaborative way to move things forward around oral health policy in Missouri. So thank you very much.
Yes. Okay, well, thank you for attending.
Thank you for having it.
All right. So we're going to call it quits?
Yeah, we'll stop right now, and you guys have a wonderful day. Thank you.
Thank you.
Thank you, everyone.
Bye-bye.
Bye.